Hello, everyone, and welcome to Living Healthy and Aging Well. My name is Ken Haglind, and we are broadcasting from the AM 950 radio station that overlooks beautiful Bryant Lake Regional Park located in Eden Prairie, Minnesota. It is another beautiful day here in the Twin Cities, and I am so grateful to be here with you today. I hope all of you listening are doing well. We are on the air every Saturday from noon to 1 to talk about your health and your life. We cover a wide range of topics to help you and your loved ones improve and enjoy your quality of life. I want to thank all of you that leave us messages on our radio show phone line. We appreciate hearing from you, and we welcome your comments, questions, and topics for future shows. Also, if you are interested in being a guest on our radio show, please call or text us at 612-999-3426. You can also contact us on our website at livinghealthyradio.com. There you can find information about upcoming guests as well as listen to our previous shows. We look forward to hearing from you. We are adding new listeners to the show each week, and we're so grateful for that, not only here in the Twin Cities of Minnesota, but also throughout the country. You can find podcasts for all of our radio shows on the AM 950 radio website, and we can also be found on iTunes, Spotify, SoundCloud, and many other streaming and podcast services. You can also watch our broadcast live on the radio station's Facebook page at AM 950 Radio. Joining me in a few minutes will be Jetta Wiedemeier Bauer. She is the manager of the volunteer and community outreach team at Trellis. Trellis is a nonprofit that has been serving older adults and those who love them for nearly 30 years. Jetta is here to discuss the Senior Linkage Line resources that are available to anyone and the ways to access free education and assistance on a variety of topics related to aging. Jetta will also be joined today by a long-term volunteer. Kelly B. is in the studio to discuss how people are helping their neighbors understand the complexities of Medicare as we head into Medicare Open enrollment this week. You will enjoy listening to my conversation today with Jetta and Kelly. If you have a question for us today, there are two ways to reach us. First, by calling the AM 950 radio station, and our friendly show engineer, Patrick, will get your call on the air. Our phone number here is 952-946-6205. Once again, 952-946-6205, or you can directly text us your questions at 612-999-3426. Now, don't worry. If you missed our contact numbers, I'll repeat them throughout the show. Also, please don't wait until the show has ended to call or text us your questions. We often receive many of the same questions after the show has ended. If you have a question, many others do as well. So please try and contact us during the show, and we look forward to answering your questions. All right. I want to welcome my guest to today's show, Jetta Wiedemeier Bauer. She is the manager of the volunteer and community outreach team, a fabulous team at Trellis. And we've got Kelly B. here, a long-term volunteer on Jetta's team. Welcome to the show.
Thank you. We're glad to be here.
This is great. You know, you've been back every year, Jetta. This is an annual process, and it's such a critical thing.
Absolutely. Because,
you know, both the populations that your organization serves, that mine serve, needs support, needs help, needs guidance, and it's not an easy thing. But before we get into this amazing topic of what the great work that you and Trellis and your organization does, let's just tell us about yourself. The audience loves to know who we're talking to. And for those who may have forgotten about you, Jetta, from last year, maybe give us a little background and you know, what inspired you to join your life's work with Trellis.
First, well, thanks so much for hosting us. We're excited to be here. I have worked with older adults my entire life. I remember at 4 years old, I was with my mom visiting shut-ins from our church. So throughout my entire life, our motto is we're built to serve. So I had an adopted grandparent when I was in high school. I have lived with my grandparents from time to time, and I've learned, you know, everything good in my life has come from someone who's been older than me. And so I was was allowed to join the Trellis team a little over 3 years ago, and to manage the public piece related to community outreach and our volunteer program. And so it's just been really a blessing because I've been able to take my passion for my family and what I love and to roll it into a profession where we're able to serve and give back. And we have volunteers on one side of my team and the community outreach side on the other side of my team. So it's just been a real treat to be able to share what's in my heart through my brain out to the community so that people can live better lives.
Yeah. Well, I remember us being here during the pandemic and, and the struggles that, trying to convert people from face-to-face meetings or group meetings to online and, telephone. And so I know you've been through quite the process over the years here. And
we certainly learned a lot.
Trying to get the message out. And it's such a critical message. And there's such a short window in terms of like the open enrollment period for people to make decisions and to have to deal with the complexities and the changes that are always going on in that area. So, well, good. Well, Kelly, tell us a little bit about your background.
Yeah, thank you for having me. So I actually started volunteering with Trellis about 4.5 years ago. And my passion into this space and wanting to advocate for and to support older adults really stemmed from my relationship that I had with my grandma. And she suffered from dementia at the end of her life. And she was in memory care. And just that whole experience, it really just kind of propelled me to want to be an ally. And so I kind of took a break from the corporate world for a bit and started finding opportunities such as this one with Trellis. And it was just really exciting because, one, it's Medicare, which isn't that exciting to the normal person or to the average person. It wasn't exciting to me. But knowing that I was going to be helping people and being able to learn about this and then kind of share the information that I had, I learned anything can really be exciting if you're helping people. So we're all aging. We're all wanting to age well, live well. We want to live. We want to thrive as we get older. And so this is a way for me to be involved in the community, and we can all help each other and inform each other on things that we happen to know maybe more about than the next person. And so if we're all in it together, for me, that's what it's about.
Well, 4.5 years, it must mean that organization's fun to work with.
Oh, absolutely. It's great. And you said, it changed a bit as we were trying to be online and all of that. And the team did a wonderful job in that piece of it. I went from being in person to doing presentations over Zoom and taking calls on the Senior Linkage Line from home. And so it's great. And I always feel supported as a volunteer with Trellis.
Yeah. And of course, there's a training program, and we'll talk more about this later in the show, which is great to have you here because if people are interested, and I'll tell you, the audience that listens to this show are big volunteers. These people have just huge hearts. I've met several of them, and I'm sure some will be interested in, what are the opportunities for us? I don't know if you guys are taking any new volunteers at this point or not, but that's something we can certainly talk about during the show as well, what that training looks like, because it is an area that's very complicated, but it's very needed in the marketplace. And of course, seniors, when you talk about what's the two most important things that they talk about, it's their finances and their health. Well, this is a really important decision because it affects both the plan you decide and how you go about it, and understanding all the implications for these Medicare plans. Oh, gosh.
Medicare is one of those things that people dread, right? There are very few people in the world that get geeked out about Medicare. We have a couple of volunteers that they spend their life just researching, and staff who research it, and they geek out on it. For the rest of the world, it brings palpitations in your heart. You're scared about it. You don't want to make the wrong decision. And so the neat thing is that the Senior Linkage Line has your back and can be the friend that just say, you know what, let me take 100 plans, ask you about 5-6 questions, figure out what your preferences are, and then put it down maybe 5 or 6 plans so that you can choose. And the neat thing about Trellis and the Senior Linkage Line is that we're objective and we're free, but we're unbiased. I don't so much care what plan you choose. I want you to choose the best plan for you. And some people want high premiums, low deductibles. Some people want high deductibles, low premiums. Some people want, ice cream with their, sprinkles on top. Some people don't. And so we try to cater to figure out whatever plan works for you is the best plan for you. And at the end of the day, I'm not financially involved in any of it. And And so it's just a good place where people can feel like I've asked my questions, I've got thoroughly confused, and someone can spend time explaining it. And the neat thing, I think, too, is that people call back. Like, we have people call back every couple of weeks, like, okay, the beginning. I mean, tomorrow is open enrollment.
Right. We make sure we let
National
people know
holiday, right? Medicare Open Enrollment, October 15th. So our phone lines on Monday will be crazy busy. But we have 7 weeks for folks. So I would say start early, go online, figure out, some questions, come in, and maybe we could do a phone appointment. Maybe we could do a Medicare appointment so that people could do it in person. And then they don't have anxiety. No one makes a good decision when they're anxious.
Right. We have a couple seconds here left. We'll talk about this on the other side. But I think one of the important things you mentioned, you guys are unbiased. There's no fee. There's no incentive other than giving the best advice, trying to help people make the best decision.
Yeah, absolutely. Yeah.
Okay. All right, it's time for a short break, folks. We'll be right back to continue our conversation with Jetta Wiedemeier Bauer, manager of the Volunteer and Community Outreach Team at Trellis, and Kelly B., a long-term volunteer at Trellis. And we're talking about the Senior Linkage Line resources that are available to anyone and the ways you can access free education and assistance on a variety of topics related to aging. If you have a question, please give us a call, 952-946-6205, or text us at 612-999-3426. I'm Ken Haglind, and you are listening to Living Healthy and Aging Well.
The Senior Linkage Line is a free, statewide service of the Minnesota Board on Aging, helping older Minnesotans and caregivers find answers and connect to services and supports. Questions about Medicare, transportation, looking to move to senior housing, overwhelmed with prescription drug plans? Call the Senior Linkage Line at 800-333-2433 or visit trellisconnects.org, where we help people optimize well-being as they age. That's trellisconnects.org.
End-of-life decisions are not easy to make. Hi, I'm Mary T. of Mary T. Hospice Care. It's important to make sure that this difficult time is meaningful and comforting to you and your loved ones. Our hospice team provides an individualized program of physical, emotional, spiritual, and practical care so your loved one is comfortable and not in pain. At Mary T. Hospice, we understand that choosing the right hospice care provider can be overwhelming, but we're here to assist you. Learn more today at marytinc.com.
Eat Local Minnesota is a great way to find locally owned Minnesota restaurants and food purveyors. You'll find high-quality food and unique eating experiences with dishes from around the world. Just visit eatlocalminnesota.com for your next meal. Crooner Supper Club invites you to Maggie's Lounge, an exciting new bar lounge. It's open Wednesdays through Sundays beginning at 4:30 for cocktails and light fare. And you don't need a ticket to enjoy the great atmosphere of Maggie's. So stop by Crooner Supper Club off Moore Lake and Highway 65 for dinner, drinks, and live music from both big-name local and national artists. Cafe Latte combines a cafe dining experience with gourmet quality food. Plus, you can still do online ordering and takeout along with gift cards. Just go to cafelatte.com and choose from their ever-changing selection of award-winning salads, sandwiches, and soups. Cafe Latte is located off Victoria and Grand and online at cafelatte.com.
Whether you rent or own a home, we all likely have nightmare stories about home maintenance, or what I like to call home cringe moments. Join me, your host, Katie Shahan, for the Yarlow Home Cringe Show. See what home cringe-worthy stories we have for you each week as we talk with local home service pros. Learn best practices for winterizing your home or what to look for after a hailstorm. Listen to the Yarlow Home Cringe Show every Sunday at 2 p.m. or on your favorite podcast app.
If you've made the decision to level your home and build new or to renovate, hire Better Futures Minnesota to take it apart by hand. Think before you scrap. Think of the energy and greenhouse gases saved by diverting what can be reused and recycled from the landfill. Better Futures Minnesota can do it for you. Hennepin County residents and public entities, there are funds available to make the environmentally right thing to do comparable to demolition. Check out betterfuturesminnesota.com. That's betterfuturesminnesota.com.
Well, welcome back, folks. You are listening to Living Healthy and Aging Well, where we talk about helping you and your loved ones improve and enjoy your quality of life. My name is Ken Haglind, and joining me today is Jetta Wiedemeier Bauer, manager of the Volunteer and Community Outreach Team at Trellis. And along with her is Kelly B., a long-term volunteer at Trellis, and she's been there for over 4.5 years, so she's well-versed in all the nuances of Medicare. And we are talking about the Senior Linkage Line resources that are available to anyone and the ways you can access free education and assistance on a variety of topics related to aging. And, of course, in addition, we're talking about people helping their neighbors understand the complexities of Medicare as we head into the Medicare Open enrollment this week. Now, Trellis is a nonprofit that's been serving older adults and those who love them for nearly 30 years. If you have a question for us, please give us a call, 952-946-6205, or text us at 612-999-3426. All right, Jetta, if people have a question or want more information, what's the best ways to reach out to you guys?
For individuals who love to use their websites, it's trellisconnects.org. A lot of information under that Get Help. You can get help with Medicare. We can direct you to resources related to dementia or pension rights or Juniper, which is evidence-based health classes. But as we look at our Medicare pieces, Medicare is a complicated piece, and we kick off Medicare Open Enrollment tomorrow. So folks typically go to trellisconnects.org, but they can also reach the Senior Linkage Line at 800-333-2433. We are available Monday through Friday, 8 to 4:30. Don't call me in the evening. Don't call me on the weekends. But we are, the state runs their service during working hours. So my tip to callers is try not to call on a Monday. It is the backed up, craziest day of the week. So if you can hold your questions off a little later in the week, you're going to have more resource and opportunities. I mean, we just know that going into open enrollment, it's busy and people want to make those changes. And, a lot of people think that they keep their plan over their lifetime and they can never change. And one of that's the biggest myth is that every year those plans change and companies come on the scene and other companies leave. And it's an opportunity to cost compare. I mean, if you go into the grocery store and you are cost comparing pasta or milk, you can do the same thing with Medicare. And it doesn't have to be hard. And if you want to do it yourself, there's different online tools that we can direct you to. If you want I call it the concierge model. If you want someone to sit right next to you and be someone to help you out and be that friend that's impartial and unbiased, the Senior Linkage Line volunteers on the Trellis team can be there for you.
Yeah. It's just such an important thing. And you're right. Every year, the insurance companies have to get approval from the state to sell products. And so sometimes approval, they may not want to offer a product or it's not approved. So it's really important to understand where you're at with your plan and then what changes you may want to make. I was telling you a situation where a relative of mine, had health changes and, started to use resources or use services locally and then didn't realize that some of those weren't covered locally. They had to go to places a long ways away, very inconvenient, and they realized, well, wait a minute, I got to make changes here to open enrollment to make sure I'm covered with the local area that would more easy to get access to and more convenient. So it's really important that people do look at this time of year.
Yeah. For that reason, providers might go out of network, right? So that's a huge piece. But also, different medications on different plans formularies may not be included for the next year. So if you're taking a medication and you're thinking all is well and you're not going to make any changes, and all of a sudden you go Jan 1 and you try and fill that prescription and it's not covered, you're going to be in for a rude awakening. So for prescriptions alone is a reason to look at open enrollment and compare plans, because that's a huge deal. Also, it might be your pharmacy doesn't have a contract anymore or has a different contract with your plan. And so you may see that your costs go up. And, well, if you go down the street to this pharmacy, you may find that your costs are lower for the same prescription. So those are definite reasons to be checking out your plan every year.
It's true. So providers on one side and then the medications on the other. And you're right. Things are almost much more fluid, it seems like these days, than they were in the past. It seems like in the past things were a little more consistent, or maybe I'm just perceiving it that way. But
I think change is what we're always into,
Yeah.
right? And that's the one thing we hate, but if you can just get used to every year it's going to change. I mean, we've talked to different couples where the woman had very low healthcare needs, the husband happened to have very high needs. They always thought they had to be together. And the neat thing is that if you sit down and talk with us, I remember this one couple, she decided to stay with the original plan they were on, and they broke him apart on the same plan, the company, but a different plan within that company, and they changed his pharmacy, and they saved $1,300 in a year.
Wow.
Right, which is just over $100 for that
Yeah.
month, right? And they were so relieved; they had no idea. Their neighbors suggested they give us a call, and that's not going to be everyone. But if we can save a couple bucks on this this prescription, or change a little bit of what they have to pay out of pocket. All of us are stretched to the gills, most of us, I should say. And so if we can just count those pennies and look at different plans, if you're flexible at all to change a pharmacy or change within a plan. My parents do it every year, and last year they didn't change. And I said, well, was it worth it? It's like, yeah, I have peace of mind knowing that this is the plan that's best for us. And for my parents to say that was awesome, right? Right, because I'm finding them to be a little more flexible. But they'll do it again next year, and they have the same woman they go to. They've gone to the same gal at this location for like 3 or 4 years. They're excited about it, and even if they didn't have a change, they have that peace of mind of knowing that it was a good use of an hour of their time, basically.
It's empowering to have that knowledge.
Yeah. Well, I think sometimes too, what I'm hearing, just because I end up working in the senior world, people will look to somebody else and say, well, what do you have? And they go, oh, this is working out great for me. But again, Medicare is a very customized, it's 150, whatever plans. What works for your neighbor or your friend may not be the right thing for you.
I always tell them, well, that's a strategy. It's not a good one.
There you go.
It is a strategy. But, you buy a car. Do you like that car? Do you buy, in this neighborhood? Oh, it was great for me. When you talk about your health care, your underlying needs, and someone has, cancer, someone has kidneys, someone has dialysis needs, someone has eye issues or macular degeneration or whatever it is, we just don't know that underlying piece of us. And then I have preferences because I travel. I want to go to, a warm location, and sometimes my plans don't work in Phoenix. Sometimes, if I go to the East Coast, if I spend 6 months of a year, we've got to have the plan that really works. And,
That's true in both locations.
Exactly.
All right. Well, I'm hearing the music, folks. It's time for a short break. We'll be right back to continue our conversation with Jetta Wiedemeier Bauer, manager of the Volunteer and Community Outreach Team at Trellis, and Kelly B., a long-term volunteer at Trellis. And we're talking about the Senior Linkage Line resources that are available to anyone in ways you can access free education and assistance on a variety of topics related to aging. And we're also discussing how people can help each other by calling the Senior Linkage Line as we head into the Medicare Open Enrollment Week. If you have a question, please give us a call, 952-946-6205, or text us, 612-999-3426. I'm Ken Haglind, and you're listening to Living Healthy and Aging Well.
My grandpa, Jim Warner, treated his customers like family, and Warner Stellian is still doing that today. I'm Angela Warner, and to thank you for 69 years, Warner Stellian Appliance is offering unbeatable savings of up to 40% off, free dishwasher installation, and no interest for 2 years with your Warner's card. Plus, go to WarnerStellian.com for an exclusive $50 coupon. These deals end October 18th, so hurry into one of our 10 Minnesota stores. You'll love your new appliances and Warner Stellian.
Hi, this is Laura. Listen to Food Freedom Radio every Saturday at 8 a.m. or anytime via podcast. Our individual health is connected to the health of each other and connected to the health of the earth. We know the problems with the dominant food system: climate change, deadening soils, nitrates in the water, factory farming, injustice, concentration of wealth. How do we both as individuals and as a community step up and support a living food system which honors the earth? Tune to Food Freedom Radio every Saturday at 8 a.m. and remember to support your independent farmers.
This is Robert Pilot of Native Roots Radio presents I'm Awake, weekdays at 5 p.m. On our show, you'll hear about Native issues like treaties, protecting Mother Earth, and holding our elected officials accountable. Weekly correspondents like Dr. Stately, State Senator Mary Kunish, Robert Lilligren, and Bob Blake update us with the latest news from Turtle Island. Native issues are human issues, and human issues are Native issues. Listen weekdays at 5 p.m. or watch the show on Native Roots Radio social media accounts. Ho-wah!
Hi, this is Frank Brown, owner of Minuteman Press Uptown, Minnesota's only minority-owned union printing company. We have big news. We've moved to North Minneapolis.
Why did you move?
As a black business owner, I wanted to be part of the North Minneapolis community to provide jobs.
Are there other reasons you moved there?
We have bigger new equipment and outgrew the other location.
What kind of new equipment do you have?
We have new equipment that allows us to print quality signage and banners. We also have a new inkjet printer, printing larger sheets, improving production efficiencies.
Is the new location easy to find?
It's not only easy to find, it's more convenient with plenty of parking. We are now located on Washington Avenue North off I-94 and the Dowling exit.
So do you still print everything?
We print more than everything. We have over 175 Google reviews with a 5-star rating. Call 612-870-0777 or visit mpuptown.com. That's mpuptown.com. We print everything.
I'm the host of Exploring Sovereignty with Elizabeth. In this radio show and podcast, we have conversations with heart-centered thought leaders to explore their pathway to becoming free, and we will shine a light on what has been hidden, often in plain sight, what they pay attention to, and how it has transformed them and others into a higher level thinking and feeling state during this time of great change. Explore being consciously aware, authentically free, and courageously sovereign with us, Sundays at 11 a.m. on AM 950, and check out our early release episodes that drop Thursdays on your favorite podcast apps.
With a look at your AM 950 weather, I'm Patrick Lilia. Cloudy today with a high of 54. Clouds linger through the night tonight with a low of 44. We're giving away viewer passes to Stephanie Miller's Sexy Liberal Comedy Tour October 21st. Listen to The Matt McNeil Show every weekday from 3 to 5 here on AM 950 for your chance to win.
Welcome back, folks. You are listening to Living Healthy and Aging Well, where we talk about helping you and your loved ones improve and enjoy your quality of life. My name is Ken Haglind, and joining me today is Jetta Wiedemeier Bauer, manager of the Volunteer and Community Outreach Team at Trellis. And we have with us Kelly B., a long-term volunteer at Trellis. And we're talking about the Senior Linkage Line resources that are available to anyone and the ways you can access free education and assistance on a variety of topics related to aging. And most important, we're discussing the complexities of Medicare and how important it is to reach out to Trellis and make sure you understand the options you have as we head into Medicare Open enrollment this week. Now, Trellis is a nonprofit that's been serving older adults and those who love them for nearly 30 years. Before we return to our conversation with Jetta and Kelly, I want to mention this radio show is brought to you in part each week by the team at Minnesota Hospice. Minnesota Hospice is an independent, locally owned medical practice serving our Twin Cities communities with comprehensive end-of-life health care. The team at Minnesota Hospice provides patients and family members with award-winning end-of-life health care services. You may not be aware that hospice brings compassionate medical, social, emotional, and spiritual services to your home with typically no cost to you or your family. Please do not wait to learn how hospice care can benefit you and your loved ones. If you have any questions regarding end-of-life care or support, please contact the compassionate team of experts at Minnesota Hospice. They are available to answer your calls 24 hours a day, 7 days a week. Their phone number is 952-898-1022. Once again, 952-898-1022. Or visit them online at minnesotahospice.com. All right, let's return to our conversation with Jetta and Kelly. If you have a question for us, please give us a call, 952-946-6205, or text us at 612-999-3426. Jetta, how can our listeners contact Trellis if they have questions or want more information?
Easiest way is at the website, trellisconnects.org. There's a fabulous tab called Get Help. And just like as it says, if you want help with education, we do presentations. You can sign up to watch our videos. You can sign up for an in-person or a virtual presentation. Some people want to meet face-to-face. And so if you need help with a Medicare, you have questions. You know, you're either new to Medicare, like in the next 2 or 3 months, you turn the magic age of 65, or if you've been doing this for a little bit, you want to know what those annual updates are, you can go into a Medicare counseling on our website. It's the Get Help tab and just say Help with Medicare. We do them on the phone. And we do them in person. And the neat thing is that you can schedule your time at whatever location. I think it's 34 locations around the Twin Cities that you can go. Bring your Medicare card. Bring a list of your medications. We're going to ask you things like, do you like to travel? Do you have a specific pharmacy that you like? Do you have a condition that we need to work with? Or do you have a specialist that you have to see that we can't change? So those are some things at the Trellis website, trellisconnects.org. Other people might want to go directly and do their own research. We have a brilliant plan finder at the federal level, Medicare.gov. And it is, you just put the information in it and it kind of pops the plans that probably fit your lifestyle. Some people love that. It's their own guide. Now, Minnesota has their own guide. It's called Minnesota Healthcare Choices. And online, it's just the letter MN, healthcarechoices.com. It is our annual Medicare guide, and it is a long document, but some people, they want to read all the details. They want to look at every plan. There's an overview of what Medicare is at the very highest levels, and then they can go into every single plan. Now, remember, you might live in one zip code, and those plans might be in another part of Minnesota. Just be real careful of where you're looking. And sometimes people will go to Medicare.gov, and they'll look at what they've got there, and then they'll go to mnhealthcarechoices.com, and they'll look at that, and then they're now thoroughly confused, or they just want that second opinion. And so folks will call the Senior Linkage Line, which is 800-333-2433, Monday through Friday, or they'll go to trellisconnects.org and they will schedule a Medicare appointment with our counselors. And this is not run by staff. This is all volunteers that, like I said, they geek out. They love Medicare. And they just, like Kelly, they want folks to make a really great decision. So those are the basic, easy ways to find us and to get some assistance. So whether you want education, you want to watch a video, you want to do a presentation in the community, maybe you're a faith group or a community group or a YMCA or the women's group at your church or mosque or synagogue, you can request that we come, and we have speakers like Kelly and myself will come on site. We do presentations on healthcare directives and fall prevention through Trellis, but we do Medicare, the annual update, preventing falls. We do things related to scams and preventing fraud and scams. So everything related to the Senior Medicare Patrol. So lots of ways to reach us.
Right. And so Trellis is not just the Senior Linkage Line. There's a whole range of programs, all kinds. Like, say, fall prevention is a huge issue in the senior community.
It is.
That can create so many domino effect problems.
And most people think falling is a natural part of growing old, and it's not.
Right.
And we do a really interactive, brilliant presentation on fall prevention that our staff do on the Juniper team, but also volunteers do. To help people figure out ways to lessen that fall. Because I tell you, once that fall happens, sometimes it's a domino effect of things. So, and we have individuals who are much younger, they're grandchildren or children of their parents, and they come in and they're like, okay, I need to do this to make the living environment better for mom or grandma. But healthcare directives, there's a lot of education out there, and Trellis does pensions, and we do healthcare classes, we do evidence-based healthcare, preventing diabetes and living with chronic pain and walking with ease. Lots of things that we do, and it's kind of neat because we've been around. Next year will be our 30th anniversary, and it's going to be a big birthday for us, and it's just kind of neat. We started with 12 people. Right? Yeah. We started with 12 people, and now our staff is just over 100, and we have 119 volunteers as of this week. It's just a very vibrant, growing place because we want to optimize well-being as we live, and as we age. And Trellis is that supportive organization that will help you get there.
Right. Great mission. I mean, what a great organization. And it's great to see 30 years. Wow, that is amazing. Well, Kelly, let's talk about Medicare changes. We've got a few minutes here of this segment. Do you want to focus on changes?
Yeah, let's talk about some changes. I mean, we already kind of talked about the individual changes that you might be impacted by, whether that's medications falling off the formulary or your provider not being within network. But there are, changes that are implemented by Medicare every year. And so I'll just talk about some of the key ones for 2024, but I actually want to pivot back to 2023 too, because there were some key ones there as well. So the Inflation Reduction Act of 2022, that brought about some changes to Medicare in 2023, and it will in 2024 and in several years after. And so the big one in 2023 is that there was a cap that was put on insulin costs. So whatever insulin medications are on a plan's formulary, it's going to cost no more than $35 per month. And so that's going to continue. So that's a really positive change. We've heard from a lot of people who call in and just saying what a positive impact that was. So something to be aware of. Also in 2023, some additional vaccines were covered at 100%. Like the shingles vaccine, tetanus. So those were covered under Part D. I know a lot of people are used to vaccines being covered under Part B, like the flu and COVID shot. These ones are covered under Part D, so just a little bit of a difference there. So the Inflation Reduction Act is bringing on additional changes for 2024. So for those who have a Part D plan, if you ever reach that catastrophic coverage phase, which basically means you've paid a lot of money for your medications, that phase is now going to be covered at 100%, and it was not previously. So a little bit of help on the financial end for those who have Part D who do reach that catastrophic phase.
Is that different for everybody, or is it the same dollar amount for everybody?
I think for 2024, the cutoff for that phase is like $8,000, and so that would be including what you pay and what the plan pays into that. So that's a positive there. Also, there is a federal program called Extra Help. It is a program that really can help with medication costs. You do have to meet some certain income and asset requirements, but one of the positive things here is that the full benefit is being expanded for those with incomes up to 150% of the poverty level. So there is additional benefit for those people. So if you have a partial benefit right now under Extra Help, that's going to automatically bump up to the full Extra Help, and you're going to see a tremendous drop in your costs of your prescriptions. So just a really positive thing there as well. Some other changes that happen really every year too is the Part B premium. So whether you have original Medicare or whether you're on an Advantage plan, you have to pay that Part B premium. Last year it actually went down a bit, which doesn't happen that often. This year it did go up. So the standard monthly premium went up about $10. So it's at $174.70. Everything, deductibles, annual deductibles, benefit deductibles, those types of things went up as well. In general, costs tend to go up every year. So we did see some costs that went down last year. And for Medicare Advantage plans, same thing. You might see differences in your premium. You might see differences in your co-pays or perhaps your out-of-pocket cost limits. So those are all things to check out individually with Medicare Advantage plans. And a couple more things, just changes to how COVID-19 is being covered. So there are some changes for 2024 that are going to be happening. Medicare is no longer going to be covering those over-the-counter tests unless you're on medical assistance, and then it will be covered through September of 2024. Lab tests, however, will still be covered. So that's important to know. Also, the vaccine, COVID-19 vaccine, still covered. The antiviral drugs are still covered if you test positive and you need that. And the last kind of big change is related to how companies can market and advertise Medicare. And this is a big deal because Medicare receives so many complaints specific to how Medicare is being advertised to them. It can be confusing. It can be misleading. And so a lot of the changes for this is on the administrative side for the companies that are advertising. So for just a couple things, for example, they have to provide opt-out notifications They have to limit advertising to the actual location where it's available. And they have to list disclaimers. Brokers, for example, right? If you're selling plans, you need to list all of the organizations that you represent. So some positive changes in that way.
Yeah, more disclosure type
Exactly.
Fantastic.
Make it a little more clear.
All right, it's time for a short break, folks. We'll be right back to continue our conversation with Jetta Wiedemeier-Bauer, manager of the Volunteer and Community Outreach Team at Trellis, and Kelly B., a long-term volunteer at Trellis. We are talking about the Senior Linkage Line resources, and we're also talking about Medicare as we head into Medicare Open enrollment this week. If you have a question for us, please give us a call, 952-946-6205, or text us at 612-999-3426. I'm Ken Haglind, and you are listening to Living Healthy and Aging Well.
There really is no place like home. Hi, I'm Mary T. of Mary T. Home Health. When you're faced with an illness or an injury, being able to stay at home and receive care is important. Our home health offers a wide range of services, including skilled nursing, physical, occupational, and speech therapies, aides, homemakers, in-home respite care, and 24/7 live-in care. We'll work closely with your primary care provider to come up with an individualized plan for you. Learn more today at marytinc.com.
The world has changed, our economy has changed, and now more than ever, it's important that your retirement savings is set up to generate income, real money in your bank account month after month while still controlling your principal. And that's what we do. We're Ferguson Financial. We set up people for retirement income. Call us today, 888-429-5569, and check out our retirement income program, Sunday mornings at 9.
Peace of mind shouldn't cost a fortune. We keep things simple at Schroman Law because we believe planning for your estate and end-of-life care shouldn't be stressful or expensive. Every client relationship starts with a free consultation so clients have the information they need before making important decisions. From there, we work closely with clients to ensure they are choosing the most efficient and cost-effective plans for their specific needs. Schedule a free consultation today at schromenlaw.com. That's SCHROMEN law.com.
Hello, this is Ellie Krug with Ellie 2.0 Radio. Now my show will be on Saturdays from 10 to 11 and replayed on Sundays from 1 to 2. You will get to the best of Ellie 2.0 with talking about idealism, with guests who come in and who are idealistic, who are trying to change the world, and you will get me, Super Idealist. Tune in. We can't wait to hear from you, and you'll hear from me Saturdays from 10 to 11.
The Senior Linkage Line is a free, statewide service of the Minnesota Board on Aging, helping older Minnesotans and caregivers find answers and connect to services and supports. Questions about Medicare, transportation, looking to move to senior housing, overwhelmed with prescription drug plans? Call the Senior Linkage Line at 800-333-2433 or visit trellisconnects.org, where we help people optimize well-being as they age. That's trellisconnects.org.
Hi, this is Paul Metza. Honored to tell you I've been broadcasting my Wall of Power radio hour show on AM 950 for over 9 years. We have had musicians that have played with Bob Dylan and Prince, local musicians, authors, comedians, CIA agents. My motto is cool people from all walks of life in all 50 states. It airs every Saturday night at 6 p.m. on AM 950, the progressive voice of Minnesota.
Welcome back, folks. You are listening to Living Healthy and Aging Well, where we talk about helping you and your loved ones improve and enjoy your quality of life. My name is Ken Haglind, and joining me today is Jetta Wiedemeier-Bauer. She's the manager of the Volunteer and Community Outreach Team at Trellis. I should say, an award-winning team at Trellis. We'll maybe talk about that for a second here. And Kelly B., a long-term volunteer at Trellis, who I'm sure was very instrumental in winning this great award here earlier this summer. And we're talking about the Senior Linkage Line resources and ways you can access free education on a variety of topics related to aging. In addition, of course, it is open enrollment week starting tomorrow. Don't call tomorrow, but you can call on Monday to Trellis and get help in understanding the complexities of Medicare. And Trellis is a nonprofit that's been serving older adults and those who love them for nearly 30 years. And you don't have to be a senior to call the linkage line. You can be a child, a grandchild, whomever, a friend, to call and help with information and guidance. Jetta, how can our listeners contact Trellis if they have questions or want more information?
Easiest way is trellisconnects.org. There are information and telephone numbers there. But if they want the general senior linkage line, it's 800-333-2433.
All right. And some of the questions coming in via text here about cost. Does it cost to have a one-on-one session, or does it cost to go attend a workshop?
Oh, great question. Absolutely nothing. We brand with the state of Minnesota. The Senior Linkage Line is a free statewide service of the Minnesota Board on Aging in partnership with Trellis and the other area agencies on aging. So it is completely free.
Wow.
Yeah.
And it's open to anybody who has a question about anything related to aging. Not just Medicare, right?
Right, absolutely. If they want to know about legal pieces, or, people call the Senior Linkage Line about chore services, transportation, housing. We will translate into over 100 languages in case the person that you love. My grandmother, for instance, before she passed, Arabic was her first language. And she would, always have questions. So I would translate, my brother would translate, and we would just make sure the information was there. But if you didn't have a family member that spoke English well, we could translate through the language line.
Fantastic. Yeah. And in terms of resources, it's like tens of thousands of resources. I mean, you guys have access to so many resources.
Yeah, our database behind the scenes is minnesotahelp.info, mnhelp.info. That is the database behind the Senior Linkage Line. It makes us look good. Mm-hmm. Trellis developed it through the Senior Linkage Line in partnership with the state, and it's all resources related to families, veterans, individuals with disabilities, not just senior services. So it's really a state of Minnesota bragging point. Minnesota Help. You can just Google mnhelp.info and find all the resources behind the scenes.
Fantastic. All right. Well, the last segment here, we want to talk a little bit about how the pandemic impacted people and how the transition and the ongoing process of making sure people are retaining coverage. Can we talk about that here?
Yeah, really briefly. We're good to see the pandemic in the rearview mirror. It's still impacting us. But as of May 11th, the public health emergency surrounding the pandemic was called, and so it was over. And during the pandemic, we didn't renew coverage because we didn't have to redetermine eligibility. As a society, we determined that people just need to gain access and stay access onto that program because we needed it. But the unfortunate part is that people moved, they lost jobs, they changed departments, and before pandemic, we always had to do an annual renewal and annual eligibility determination. So as of May 11th, we in the state of Minnesota, as well as everyone else, need to do a redetermination for medical assistance. At the federal level, we call it Medicaid. And what's happening is that people have moved and they're not renewing. The county is trying to send letters out in the mail. They're not finding individuals. Folks, maybe English is their second language or third language, really struggling. And what we found is in the first couple months between May, June, July, over 100,000 people in Minnesota have lost coverage because they didn't know that they needed to renew. Now, we know that some people aren't going to be eligible because they're over income, and we want to reserve these programs, whether it's Minnesota Care, MN Care, or medical assistance. These are for our most vulnerable Minnesotans, right? We want to hold them up. And so some people will be over income, and that's fine. But there are other people that have moved and the letters aren't getting to them. So what I always ask is that if you love someone that you know is lower income and that they've struggled a little bit, check in with them. Be a good human today, whether it's in your faith community, in your neighborhood, it's the little lady across the street, or it's your grandmother. Check in to see, have they renewed their coverage? Have they filled out that form from the county? And if they have nowhere to turn, the back of their health coverage, call in, make sure your address is on file, because in this we have cohorts by month. So my month might be September, yours might be November, Kelly's might be January, and we just don't know when the eligibility turns. So contact your health insurance company. If you can't figure it out there, contact the county where you're living right now. And, if you've moved, things are shifting. The last resort is call the Senior Linkage Line. We can help try to unwind. And they call it the unwinding of Medicaid from Medicare for our older adults. But this is a scenario what's impacting young families with children. It's impacting our middle-income Minnesotans. Anyone who's at risk of being, needing assistance for welfare or assistance or just lower income.
Yeah.
So it's a really big issue. So we love that the pandemic's behind us, but it's still with us a little bit.
Right. And you're right. A lot of people ended up moving in with family during that period of time for a number of reasons. One, they couldn't see each other. There was access. There was just they just needed help. And you're right. I think people can lose track then of being connected. With the resources they need. To stay covered. Wow.
So just making that call out, that person you see at church or the mosque or the synagogue or the person in your neighborhood or the community center, they're probably a little isolated. And just be a good person today. Check in on them and do that good thing in the next week and just say, hey, did you get your letter? Are you eligible for medical assistance? Have you gotten, are you getting a regular piece of paper in the mail from the county? And, if you're like my family, they get that county letter and they put it in a pile and they circular file it, don't do it. Right. The new marketing strategies for the county is it's a white envelope, which is kind of boring, but it's got a big old dot on it. And it, basically, when you see the dot in blue, it's time to renew. Catchy marketing.
Yeah, right.
But when that document from whatever county you live in, and it's all over Minnesota, whether it's the Twin Cities or it's Ely or it's Rochester, open that thing, make sure you understand it, have someone you love read it with you, and act. You've got to act now because we do not want our most vulnerable Minnesotans losing more coverage.
Right. Wow. All right. Well, that's the end of the show, folks. Boy, that was fast. We got so much we could talk about.
So much fun.
No, so much fun. Medicare. No, this is great. You guys make this so exciting. No, I do. I want to thank Jetta Wiedemeier Bauer, manager of the volunteer and community outreach team at Trellis, award-winning team at Trellis, and Kelly B., a long-term volunteer at Trellis, for being here to talk about the Senior Linkage Line resources and the free education that's available. And it's so important to contact Trellis starting Monday if you have any questions regarding the Medicare Open enrollment period. All right. I hope you enjoyed today's show, folks. Please contact us with any comments or questions you have regarding today's conversation. You can reach us anytime by voice or text at 612-999-3426. Join us again next Saturday at noon for another broadcast. And thank you for listening to Living Healthy and Aging Well, where we talk about your health and your life. Until next time, choose to live well.